Have you ever noticed something strange when you go to the bathroom? Maybe a bulge, pressure, or even tissue slipping out where it shouldn't? Here's the shocking truth. Millions of people silently suffer from rectal prolapse, and most of them have no idea what's really happening. Doctors often don't explain the full picture, and by the time many people take it seriously, it's already too late. In this video, I'm going to reveal the secrets about rectal prolapse that your doctor might not tell you, how to spot it early, what really causes it, and most importantly, how you can fix it before it gets worse. Rectal prolapse sounds like a terrifying diagnosis, but let's strip away the fear and talk about what it really is. Simply put, rectal prolapse is when part of the rectum, the last section of your large intestine, slips out of place and sometimes pushes outside the body. It can start small. Maybe you just notice a little bit of tissue during a bowel movement, but over time it can progress to a stage where it's visible even when you're standing or walking. The worst part? Many people ignore the signs because they're embarrassed or they assume it's just hemorrhoids. But hemorrhoids and prolapse are not the same thing. Confusing the two can cost you years of worsening symptoms and missed chances for easier treatment. Now here's the first secret your doctor might not emphasize. Rectal prolapse doesn't just come out of nowhere. It's usually a result of years of hidden strain. Chronic constipation is one of the leading culprits. Every time you push and strain on the toilet, you're putting stress on the muscles and ligaments that hold the rectum in place. Over time, those supports stretch out and weaken until the rectum itself starts to slip. But constipation isn't the only factor. Aging, nerve damage, repeated childbirth, pelvic floor disorders, and even conditions like cystic fibrosis or chronic coughing can play a role. And here's something many patients are never told. Even surgeries for other pelvic conditions can increase your risk of prolapse later in life. Let's talk symptoms, because here's where it gets tricky. Rectal prolapse doesn't always announce itself in an obvious way. Early signs can be subtle, like feeling as though you never completely empty your bowels, needing to strain harder than normal, or noticing mucus leakage that stains your underwear. Some people feel a heaviness or pressure in the pelvic region, while others notice a visible bulge during bowel movements. The dangerous thing is that these symptoms creep in slowly. By the time tissue is consistently protruding, the condition has already advanced. And here's the part many doctors don't say up front. Once the rectum is prolapsed, it does not fix itself. No amount of waiting or hoping will make it reverse naturally. So why don't doctors talk about it more openly? The truth is, rectal prolapse is a condition surrounded by silence and stigma. Patients are embarrassed to bring it up, and physicians sometimes minimize it until it becomes severe. On top of that, treatment options are often presented as last resort only when the situation is dire, which means many people live with unnecessary discomfort for years. But knowledge is power, and if you're watching this, you're already one step ahead. Here's the next big secret. You have more control over this condition than you think, especially in the early stages. Lifestyle changes can't always reverse prolapse, but they can slow it down dramatically and prevent it from getting worse. Managing constipation is absolutely critical. That means increasing your fiber intake with fruits, vegetables, beans, and whole grains. Hydration is equally important. Dehydration makes stools harder and more difficult to pass. Regular physical activity keeps the bowels moving and reduces straining. But here's something rarely discussed. Pelvic floor exercises, often known as Kegels, can strengthen the muscles that help hold the rectum in place. These exercises are usually recommended for urinary incontinence, but they also benefit rectal support. Learning how to do them properly can make a real difference in comfort and progression. Now let's clear up another misconception. Many people believe surgery is the only treatment option. While it's true that advanced rectal prolapse often requires surgery to fix permanently, there are stages where non-surgical management is possible. Biofeedback therapy, for example, trains you to improve bowel habits and strengthen the pelvic floor. Avoiding heavy lifting and learning better posture during bowel movements can also reduce strain. These aren't cures, but they buy valuable time and improve quality of life. But what if you're already dealing with more severe prolapse? Here's where honesty is essential. Surgery can sound intimidating, but the good news is that techniques have improved significantly. Today, there are minimally invasive approaches, including laparoscopic and robotic surgeries, that reduce recovery time and carry fewer risks. The choice of surgery depends on your overall health, age, and the severity of the prolapse. Some procedures lift and secure the rectum in place, while others remove weakened tissue. What most patients don't know is that untreated rectal prolapse can lead to far worse problems: chronic bleeding, fecal incontinence, ulcers, and infections. In rare cases, the prolapse tissue can be trapped outside the body and lose blood supply, which is a medical emergency. So waiting too long isn't just uncomfortable, it's dangerous. Now, here's a secret no one talks about. Rectal prolapse isn't just a physical issue, it's an emotional one. Many people suffer in silence because they're ashamed to talk about it. They avoid social situations, stop exercising, and live in constant fear of accidents. This silence creates a cycle where people don't seek help until the condition is unbearable. Breaking that silence is one of the most powerful things you can do. If you suspect prolapse, talk to your doctor openly and insist on a thorough evaluation. The earlier you get help, the more options you'll have, and the less invasive treatment will be. Prevention is another area filled with hidden truths. Did you know that your bathroom habits can make or break your rectal health? Sitting on the toilet for long periods, scrolling on your phone, or pushing too hard all contribute to weakening the pelvic floor. One practical hack is to change your toilet posture. Elevating your feet with a small stool, like a squatty potty, aligns your colon more naturally and makes elimination easier, reducing strain. Small adjustments like this, done insistently, can protect you from worsening prolapse. So let's recap the secrets most doctors don't highlight. First, rectal prolapse isn't just an old person's problem, it can affect anyone, especially those with chronic constipation or pelvic floor weakness. Second, early signs often mimic hemorrhoids, so don't assume. It's worth getting checked. Third, lifestyle changes and pelvic floor strengthening can make a real difference, even if they don't cure the problem outright. Fourth, modern surgical treatments are safer and more effective than ever, and waiting too long can cause irreversible damage. And finally, the biggest secret of all, talking about rectal prolapse openly can save you from years of hidden suffering. If you've been experiencing unexplained bowel symptoms, pelvic pressure, or tissue protrusion, don't wait. The sooner you address it, the more power you have over the outcome. Your body is sending you signals, and ignoring them doesn't make them disappear. Rectal prolapse may be an uncomfortable topic, but facing it head-on could be the difference between simple management and life-altering complications. Thanks for watching. If this video helped you, make sure to hit like and subscribe, because breaking the silence around taboo health issues is what this channel is all about. And remember, your health is too important to leave in the dark. Take action today, because fixing rectal prolapse before it's too late is not just possible, it's in your hands.